Well, tell us what happened with this.
Well, basically, when these trials are going on, I mean, this is actually a good thing because it shows that these companies, they're taking this very seriously. And basically, when there's an adverse event, as what apparently has happened here, in some cases, depending on the level 1 through 5, sometimes they can halt the entire trial to really investigate what's going on, because safety, that's the primary concern of these pharmaceutical companies. And they're demonstrating that they're really honoring this by halting the trial so they can investigate what happened.
Mm-hmm. And talk to us a little bit about the safety of this. Should we be concerned here? What adverse reactions might this drug have?
Well, normally with vaccines, some of the more common adverse reactions would be maybe pain at the injection site. Some people can get a little fever. Some people can get a little fatigue. These are adverse events, or we call them in investigations AE, adverse events. And then you can have SAEs, which are serious adverse events, and that's when somebody is seriously ill. And depending on the level, we rank it from 1 to 5. The clinical trial can be paused so that we can really see what's going on. Now, during this investigation period, we investigate, was it something that was underlying that maybe was not diagnosed or picked up before the trial started? That would be considered a pre-existing problem. And then we also want to make sure that it's not a problem that's caused by the medical intervention, in this case, the vaccine. And then it could be something that's not related to the vaccine. But the most important thing is these companies are demonstrating that they're very serious about this, because they're not letting anything go. I mean, this investigation, this pause, I take this as a confirmation that this research that's going on is being taken seriously, and nothing is being overlooked. And safety is the #1 priority, and this is being demonstrated in this case here.
And how much of an impact could this all have on the timeline of pushing out a vaccine?
You know, in this article that I was reviewing earlier, AstraZeneca did ensure that they're going to do everything they can to get back on track. But first, and most important, they're going to make sure that this medication is safe. So if the timeline is delayed, a lot of money will be lost in reality. But as I said before, this is a demonstration that AstraZeneca is taking it seriously, and the governing board, such as the FDA, they're taking it seriously as well. And even if money is lost, we're still going to make sure that we do our due diligence and put safety before profit. So this is really reassuring to me and the medical community that these trials are being taken seriously, and safety is #1.
All right. Well, thank you so much, Dr. Quinn, for joining us. I'm sure we'll talk to you really soon. For 12 News, I'm Jade Balexa.
Thank you, Jade. Dr. Quinn will